ICD-10 CM update. What's new in 2025? The 2025 ICD-10 CM update, released by the CDC on July 3, 2024, brings key changes to diagnostic coding, effective October 1, 2024. This update includes 252 new codes, 36 deletions, 13 revisions. These updates focus on improving specificity in coding while reducing the overall number of new codes. This shift includes the introduction of non-billable parent codes, which now have more detailed child codes. Chapter-wise classification. Chapter 2. Neoplasms. The new 63 diagnosis codes are added under lymphoma category C81-C88, depending on whether the condition is in remission or not having remission. Example codes: C81.2a, mixed cellularity Hodgkin lymphoma, in remission. C81.3a, lymphocyte-depleted Hodgkin lymphoma, in remission. C82.5a, diffuse follicle center lymphoma, in remission. Coding for breast implant-associated anaplastic large cell lymphoma, BR-ALCL. When coding for BR-ALCL, use the following specific codes instead of the general complication codes found in Chapter 19, some text. C84.7a. This code is used for BR-ALCL which is currently active. Currently active for BR-ALCL C84.7b. This code is used when BR-ALCL is in remission. Coding for malignant neoplasm of lymphoid tissue metastasizes. If a lymphoma spreads beyond the lymph nodes to other organs, use a code from categories C81-C85 that specifically indicates extranodal and solid organ sites. Example: if a diffuse large B-cell lymphoma spreads to the lung, brain, and left adrenal gland, use code C83.398. Chapter 3. Disease of the blood and blood-forming organs and certain disorders involving the immune mechanism. Just one new code is added here, D61.03 Fanconi anemia. A rare genetic disorder, Fanconi anemia, now has its own ICD-10 CM diagnosis code, D61.03, enabling better tracking of this condition, which affects bone marrow and increases malignancy risk. This condition is classified as a complication and comorbidity, CC, for FY 2025. Chapter 4. Endocrine, nutritional, and metabolic diseases. For presymptomatic type 1 diabetes mellitus or early-stage type 1 diabetes that predates the onset of symptoms, assign code from category E10. A type 1 diabetes mellitus, presymptomatic. Levels and classes added. Specific levels for hypoglycemia and classes for obesity have been introduced. E16. A2. Hypoglycemia level 2. E16. A3. Hypoglycemia level 3. E66.81. Obesity, class. E66.811. Obesity, class 1. Chapter 5. Mental, behavioral and neurodevelopmental disorders. The existing codes for anorexia and bulimia from the eating disorder category, F50, are expanded based on the severity, such as mild, moderate, severe, extreme, in remission, unspecified. A total of 4 codes are deleted and expanded into 26 new codes based on specific severity. F50.010, anorexia nervosa, restricting type, mild. F50.023, anorexia nervosa, binge eating, purging type, extreme. New codes for adults. F50.814, binge eating disorder, in remission. F50.83, pica in adults. F50.84, rumination disorder in adults. Chapter 6. Diseases of the nervous system. There are several changes under G40 epilepsy and recurrent seizures, including the addition of G40.84 KCNQ2 related epilepsy and 4 child codes, G40.841, G40.844, to specify whether or not the disease is intractable, with status epilepticus. There are also new codes for serotonin syndrome, G90.81, other disorders of the autonomic nervous system, G90.889, and developmental and epileptic encephalopathy, G93.45. Chapter 9. Diseases of the circulatory system. 4 new codes were added, and 2 code descriptions were revised for the pulmonary embolism from the I-26 category code. The new codes were added for cement and fat pulmonary embolism. I-26.03 cement embolism of the pulmonary artery with acute cor pulmonale. I-26.04 fat embolism of the pulmonary artery with acute cor pulmonale. I-26.95 cement embolism of the pulmonary artery without acute cor pulmonale. I-26.96 fat embolism of the pulmonary artery without acute cor pulmonale. The guidelines for I-21. A1 type 2 myocardial infarction due to demand ischemia or secondary to ischemic imbalance are revised. The underlying etiology that causes the type 2 myocardial infarction, if applicable, should be coded first. Previously, its mandate was to assign myocardial infarction etiology first. Chapter 10. Diseases of the respiratory system. 7 new codes were added for internal nasal valve collapse in the J34 category, other and unspecified nose and nasal sinus disorders. J34.8200 internal nasal valve collapse, unspecified. J34.8201 internal nasal valve collapse, static. J34.8202 internal nasal valve collapse, dynamic. J34.8210 external nasal valve collapse, unspecified. J34.8211 external nasal valve collapse, static. J34.8212 external nasal valve collapse, dynamic. J34.829 nasal valve collapse, unspecified. Chapter 11. Diseases of the digestive system. New 27 codes were added under fissure and fistula of anal and rectal regions K60 for the below category based on the nature of the occurrences and the complexity, severity of the diagnosis, including K60.311, anal fistula, simple, initial. K60.32, anal fistula, complex. K60.413, rectal fistula, simple, recurrent. Chapter 12. Diseases of the skin and subcutaneous tissue. Under L29 pruritus, there are new codes for cholestatic pruritus, L29.81, and other pruritus, L29.89. And under L43 lichen planus, 6 new 5th character codes more fully describe lichen planopilaris, L66.10, L66.12, L66.19, and central centrifugal cicatricial alopecia, L66.81, L66.89. Chapter 13. Diseases of the musculoskeletal system and connective tissue. This section on intervertebral disc degeneration, category M15, now provides more detailed codes for the lumbar and lumbosacral regions. Pain-specific location is added. Back pain only, for cases where the pain is limited to the back. Leg pain only, for cases where the pain radiates down the leg, like sciatica. Both back and leg pain, when both areas are affected. No specific pain location, when the documentation doesn't specify where the pain is. Diagnosis code M659 synovitis and tenosynovitis, unspecified, is expanded with 24 codes based on the location, body part. The changes are elaborated in the table below. M65.971, unspecified synovitis, right ankle and foot. M65.972, unspecified synovitis, left ankle and foot. M65.979, unspecified synovitis, unspecified ankle and foot. Chapter 14. Diseases of genitourinary system. Other than the addition of an excludes one note under N39.0 urinary tract infection, site not specified, there's nothing exciting going on here. Chapter 15. Pregnancy, childbirth, and the puerperium. This chapter has a few note changes to codes in subcategory 024 diabetes mellitus in pregnancy, childbirth, and the puerperium. Chapter 19. Injury, poisoning, and certain other consequences of external causes. 30 new codes are added under this section for the below diagnosis. Poisoning and adverse effects by immune checkpoint inhibitors and immunostimulant drugs, T45. ACTS. Disruption of internal operation, surgical, wound, not elsewhere classified, T81.32. Category code expanded into below codes. Some text. Gastrointestinal tract anastomosis, repair. Closure of internal operation, surgical, wound of abdominal wall muscle or fascia. Closure of other specified internal operation, surgical, wound. Unspecified operation wound. Chapter 21. Factors influencing health status and contact with health services. A total of 25 new codes are added, and 2 codes are deleted. In this final chapter of ICD-10 CM, there are new codes for reporting genetic susceptibility to various diseases such as epilepsy and neurodevelopmental disorders, Z15.1, and obesity, Z15.2. Additionally, the descriptor for subcategory Z17 is revised to expand the scope of hormones to include progesterone and human epidermal growth factor and to specify receptor status. Also new for FY 2025. Z51. A encounter for sepsis aftercare. 2 new social determinants of health codes for insufficient health insurance coverage, Z59.71, or welfare support, Z59.72. Several codes, Z67. A. For identifying blood types using the Duffy blood group system. 2 codes, Z68.55, Z68.56, for identifying pediatric body mass index percentiles. A code for reporting family history of familial adenomatous polyposis, Z83.72, and 4 codes for reporting a personal history of specific types of colon polyps, Z86.0100, Z86.0102, Z86.0109.